Sawadee and good afternoon once again. Today is Tuesday, the 6th of July, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or Ccsa, as always. So I'm very glad to be back here this week. First of all, thank you, Dr. Tawisin, just now for the Thai version. One important piece of information, a little bit of good news within all the challenging news that we have, is that the old clusters in some construction sites have turned green now. So around 29 of these construction sites, which had previously been the clusters in Bangkok, either the north, south, east, or west of Bangkok, have now turned green, meaning that the situation has been resolved already. So hoping that the green clusters in terms of the Bangkok construction sites will continue to improve. So first off, with the vaccination progress, as of yesterday, the 5th of July, 2021, we have administered already a total of over 11 million doses of vaccines. To be exact, 11.05 million doses, wherein 8.02 million people have received their first dose and 3.03 million people have been fully vaccinated. The inoculation drive has now covered 26% already of those residing in the Bangkok metropolitan area. And in the national coverage, it now stands at 11.1% of the entire population. So at the rate that we are going, I believe that in July we'll be successful in inoculating the targeted number of people, just like how we started off in the beginning of June, and by the end of June we did reach the target of 10 million people. So now we have over 11 million people. Doses being inoculated. The inoculation in tourist destinations also continues. Koh Samui and Koh Tao also covered almost 70% of the population already. This number is the progress in preparation for both of these destinations, Samui and Koh Tao, which will be fully open to tourists soon in the month of July, following the pilot project province of Phuket, as you would have known. Now, as we mentioned yesterday in the briefing, the Ccsa has to adjust the strategy and priority group to a certain level because of the changing situation. Now, I'm talking about, of course, the higher risk that the Delta variant is posing to Thailand. So in the adjustment of this priority group, if you recall, in the beginning of the vaccination drive, we had focused on those who are 60 years old and above, and those with the 7 underlying medical conditions. And after that phase, we continued on with the general public in Thailand. Now, with the higher number of fatalities and infections because of the Delta variant in particular, we have to cope with this high number. We will have to refocus the goal and the strategy to return to inoculating adults aged 60 and over, as well as those with the 7 underlying conditions. Now, to do that, we aim to inoculate with a new target of 70% of adults aged 60 and over, and people with the 7 diseases residing in Bangkok within the next 2 weeks. So in summary, within the next 2 weeks, we hope that 70% of this group will be inoculated. The high-risk groups living elsewhere in the country, around the country, will also receive the vaccine within the month of August as well. Now, this does not mean that all of the vaccination drive that we have prepared will be halted. Of course not. It's just a slight refocus of the groups. Now, of course, many of the 60 plus and those with underlying medical conditions, many have been inoculated already. We just have to inoculate the rest and to a higher level. And of course, the appointments in terms of the vaccination, some of those would have to be adjusted because of the changing situation. But rest assured that the vaccine supply and the management is well aware of those who have not been vaccinated yet and are in the queue to be vaccinated. Now, to realize this goal, particularly for the foreign nationals in Thailand, the Department of Disease Control is aware of this, that of course many foreign nationals are over 60 and many foreign nationals have underlying medical conditions, those foreign nationals in Thailand. So they are as well in the high risk group. They'll be able to register for this vaccination appointment, the continuous vaccination appointment. Now, the website, which is thailandintervac.com, had been open for quite some time. But of course, with the supply of vaccines and all the distribution of the vaccines to different locations, the portal has had to be opened and closed during some portions of the day. It wasn't closed entirely, of course. It was closed when it was full in that duration of the day, and then open again on the next day, things like that. So it was available, but then with a limited capacity. Now, the Department of Disease Control has adjusted this a little bit to be more convenient. If you go into the thailandintervac.com website now, you will be directed to a link of Payathai 2 Hospital, as well as information about Samittiwet Sukhumvit Hospital. Now, foreign nationals who are qualified can either register with Payathai 2 Hospital on their website. We had that on screen just now, payathai2international.com, from the 12th to the 16th of July, or with Samittiwet Sukhumvit Hospital by directly contacting the hospital. Now, this is not a separate scheme from the Thailand Intervac. It's part of the thailandintervac.com linked to these two registration. For additional registration for those who have not been able to secure appointments yet. So, as you see, the adjustments would have to be made for more efficiency according to the situation, the higher risk of Delta, and of course, those who have not received their appointment can continue to go into the website that was mentioned. So please bear with us, of course. We have a lot of things to manage, but rest assured that your turn will come. The general situation and number of cases that we have for today. There'll be an infographic coming up on screen for you. So today, new confirmed case, we have 5,420. Active cases still being treated in Thailand at the moment are a number up to 65,297, out of which 2,350 are those cases in critical condition, and 643 are those patients on ventilators. We have new recoveries at 3,586. We have new fatalities numbering at 57, with the median age at 62. Now, you would notice that the median age prior to this period was lower than 62, lower than this age. So the trend is starting to be that the median age of those fatalities, unfortunately, are getting older. So that's why the refocus in our strategy has to be made to focus more on the vaccination of those over 60 and those with underlying diseases. We, of course, send our deepest condolences to those who are mourning loved ones who have passed away from COVID, and we highly suggest that the families continue to strictly practice the important measures. On the overall situation, we'll have on screen for you a slide on the top 10 provinces. We have Bangkok as first, 1,492, followed by other provinces which are mostly in the central region of Thailand, as you can see on screen. Also, some along the list are provinces which are in the southern part of Thailand, like Pattani, Yala, and Songkhla. Just some observations from today's Ccsa meeting this morning. The Department of Disease Control reported that 52% of COVID cases in Bangkok were found to be of the Delta variant. Now, if you see on screen there, that's a map of Bangkok, the spatial map of Bangkok, and you have the proportion, the pie up there, which says Delta and Alpha. So this actually illustrates that currently, the Alpha variant is still the most prevalent one in Bangkok, a little bit more than the Delta. However, the Delta is a high risk that is posed in Bangkok. And the Delta strain has already been found in 47 other provinces. And the spread of the Delta variant is faster than expected. So we have to be very, very careful. And this is another pie chart in terms of Delta, Alpha, and Beta. We'll keep tab on this, on how these variants adversely affect the health situation in Bangkok and in Thailand. The pie on the right, there's two small pie charts on the right. The top one is actually Bangkok. In blue, 47% is Alpha, and in yellow, 52% is Delta. And the small pie on the bottom, that's actually the other provinces within the country. You see that Alpha is more than Delta, but Delta spreads very fast. So we have to be very, very careful of this. Now, almost half of the new confirmed cases today were found in provinces outside Bangkok. Many cases infected from people who have traveled from Bangkok to their hometowns, especially in the northeast or Isan region, where 17 out of 20 provinces have already found cases related to interprovincial travel. And therefore, the Ccsa still encourages people to avoid or discourage people to travel outside the provinces at this time. The Disease Control Department also discussed about the new cases found to be related in restaurants. In total, 167 confirmed cases were found to be those who have visited or worked in restaurants in Bangkok area alone. And similar cases of infections in restaurants were found in at least 48 provinces. And for this reason, some disease control measures are still needed to control the spread of the virus. And in this premises, then in the premises of the restaurants, and will be revised by the Department of Disease Control periodically. Just an update on vaccine procurement, as today is Tuesday, and Tuesday we have the cabinet meeting, weekly cabinet meeting. Today, the Cabinet considered the agreement to procure 20 million doses of Pfizer. This mRNA vaccine expected to be delivered by the fourth quarter. And moreover, the Attorney General's office have finished their review of the agreement to procure the Moderna vaccine. And the government pharmaceutical organization is now working on the deal to be signed as soon as possible. And on the booster shot, you may have been seeing in the news about the third vaccination shot. The government is considering the vaccine booster shot initially to the healthcare workers. And just this morning, the advisor to the Ccsa, Dr. Udom Kashinthorn, clarified that the health ministry is now studying the possibility of giving the viral vector vaccine or mRNA vaccine as a booster shot to people with high exposure risk, especially frontline workers. However, this is still under review in terms of the numbers and the medical studies to ensure that the third vaccination shot would be safe, the safest and the most effective. So the Ccsa and the Health Ministry would like to reiterate that the safety of frontline workers remain of utmost importance in this battle ahead. And just before closing today, as many foreign residents in Thailand live in condominiums or apartments, I'd just like to talk shortly about just some guidelines to prevent COVID for those living in these kinds of residences. As you see in the infographic shown on screen, you can find this on the social media Facebook page of the Public Relations Department. One of the most important issues, if there's a report of infection or high-risk persons in a condominium or residence, the person is required to stay in quarantine and follow the instruction from the contacted hospital. This is, of course, the initial step. The juristic person of the condominium should be responsible for the infected person's information and regularly clean the risky surfaces, especially common areas like elevators in the condominiums, including the separate waste bins and those that in areas that have the risk of contamination for the other tenants of the condominium. And the residents and staff should also help each other in keeping contact through online channels and self-monitoring activities. I'm sure that many condominiums have a social media chat group or a line group, and they regularly talk to the residents of the condominium on the various measures and things to be careful of during this time. So, with that, I thank you for your attention. We'll be back with the English language summary of the daily press briefing tomorrow. Thank you for your attention, and please stay safe and stay healthy. สวัสดีครับ